Good morning. I'm Amy Nolan, Vice President of Regional Enhancement, and I want to welcome you to the final Capital Connections of this legislative season. These discussions are designed to help connect you, the business community, to legislative issues that could impact business. So, thank you all for coming this morning. Before we get started with our program, I'd like to thank Iris Networks, Shaw Companies, AT&T, and JP Morgan Chase for their sponsorship and support of this series. We appreciate their continued support and investment in the Chamber's mission and our community. We are fortunate this morning to have Senator Becky Massey, Senator Richard Briggs, and Representative Dave Wright. We also help, I think Representative Michele Carringer is having some technical difficulties, but I think she'll join us later in the program. And now it's my pleasure to introduce our moderator, and I'm going to take a minute of personal privilege here. Susan Richardson Williams has been chairman of our Business Climate Council, formerly known as Government Relations and Public Policy Committee, for the past 12 years. Probably the longest serving chair in at least one of them in chamber history. And so this is going to be her swan song in June. So I want to thank her for all she's done for the chamber and for me personally as a friend and really a fantastic mentor. So with that, Susan, I'll give it to you to take away.
Thank you, Amy. And yes, I think I am the longest serving chairman and maybe board member in history. But it's been fun, and I look forward to having a new chairman to work with. Before we get started, thank you all for joining us this morning. And I want to reintroduce our panelists and tell you a little bit about them and the committees they serve on. Senator Becky Massey is chairman of the Senate Transportation and Safety Committee. She also serves on Health and Welfare and chairs the Knox County delegation. So thank you, Becky, for being with us. Senator Richard Briggs, chairman of Senate State and Local Government Committee, vice chair of Rules, and a member of Transportation and Safety. Representative Dave Wright is vice chair of the House Local Government Committee, member of the House Ag and Natural Resources. So thank you guys for being here. I know it's been a long week, but as a friend of mine used to say, the legislature's adjourned. We can all sleep safely now. We're going to start this morning talking about some issues that may not have made the headlines, but are important to the business community. So Senator Massey, let's start with you. We've had a growing concern among employers that childcare has become expensive and limited. Parents are staying out of the workforce because they're having to stay home with their kids. You championed the creation of a child care task force, which was funded in the governor's budget. Can you talk about that and tell us what you hope can be accomplished through that task force?
Thank you, Susan, and it's always great to be with my friends here, chamber members, and with my fellow legislators. But yes, it's the Department of Human Resources has basically, they kind of did a top-down study just internally here recently, but where we need to, we're not utilizing our federal money coming down that's for childcare as efficiently as we need to. So what I'm hoping on this task force is to really look at it from the consumer up and make sure that it's consumer friendly as far as being able to apply for and get those stipends and supplemental payments that people need to be able to access the child care, and to just basically make it more user friendly, and that we're accessing all the dollars that are available to help people get back to the workforce, because we absolutely don't want someone not working just because of the child care cost.
Good. Well, thanks for doing that. I know a lot of people are struggling with that. Senator Briggs, before we get to the question, I want to thank you for working with the chamber and Representative Sam McKenzie on a bill that, without going into all the details, allows local government to connect with more diverse businesses in our community. So thank you about that. You've worked for several years on a bill that was related to pharmacy benefits management. Employers were kind of on both sides of the issue, but talk about that legislation, which I think passed on the last day, and what does it mean for businesses?
Well, what it is, this is what they call my part of it was the 340B program. And first of all, Susan, it's always good to be back here. I think between my time on the county commission, I'll be starting my 15th year of either being on the government relations committee or with the development corporation or the industrial development board. So I always feel like I'm coming home when I'm coming back here. So it's always great to see everyone, even if it's just virtual. But I believe the program that you're talking about is the 340B program. And what that program does, it's complicated, but I'll try to summarize it very quickly, is that a pharmaceutical company that wants to have their drug put on the government formulary agrees to sell those drugs at a discount to some of the not-for-profits, what they call the 340B entity. It's really not a state program, it's a federal program. It's been around since the early 1990s, 1992 to be exact, and it was the first President Bush that signed that into law. Those funds, the discount that they give to the 340B entities, the funds that comes back in the form of a rebate can be used to fund not-for-profits. Like here in town, it funds like children's hospitals, a lot of these not-for-profits, the UT Medical Center, certain programs there, drug rehabilitations. So it really has a lot of benefit. Now, also this bill that passed, and it was Senator Reeves that passed the other part of this bill, would also protect the small pharmacies a bit against being crowded out against the pharmacy benefit managers. It really did have both folks that were for it and against it, depending on what side you're looking at. I think the healthcare providers were for it. Hometown pharmacies were for it. There was the Tennessee Chamber of Commerce was neutral because they did not feel that this was counter to Tennessee businesses. But it was a controversial bill, but it will definitely benefit some of our not-for-profit healthcare agencies, but it'll also benefit and protect some of the small businesses, small independent businesses, such as the small town pharmacies.
Thank you for that. Representative Wright, you've been focused for the past several years on bills that improve the lives of veterans. This year, you co-sponsored a bill regarding re-employment for National Guard members. Can you talk about that and tell us what is happening with that bill?
Thanks for the introduction. First, let me say, though, that I appreciate being invited this morning to participate. I'd also like to interject that as with Dr. Briggs, he has about a minute and a half more seniority than I have at being in local government or state government. And then Senator Massey has taken me under her wing as the delegation head, and we all work together trying to advance not only the interests of state of Tennessee, but that of Knox County. Speaking of veterans, I served 3 years in the Army. Dr. Briggs served several years in a lot more hazardous situations than I did, but we still look back on those times as times that we learned, grew, and became better citizens. Each year that I've been state legislature, and this is the end of the third year, I've tried to carry something on purpose, carry something that would benefit veterans. And this year, the bill turned out to be reemployment rights of National Guard members who are returning from active duty, to make sure that just as federal law would require them to be reemployed, that the state law would require National Guard members coming back from duty to be reemployed. Sort of a long way of getting around what everyone has probably been doing in the past, but just to make sure it's in the state code.
All right, well, thank you for that. I know the veterans appreciate it. Let's talk a little bit about baseball, local concern to all of us. The governor squashed the idea, Senator Massey, of a quarter-mile sales tax district to help pay for this facility that's being proposed for downtown. And they did, however, dedicate $13.5 million to the effort to instead of doing the local tax. Talk about that, and how did that come about? Was that something you all were lobbying for with the governor, or was it the governor's idea? And do you think it's going to be something that will really benefit this proposal? Becky, let's start with you.
Well, absolutely. It was an interesting process. When we had it before the the Senate Finance Committee, it was interesting. The perception was, oh no, it's not going to pass, a cold wind's blowing. Well, I had 9 of the 11 votes that were going to vote for my bill. But basically the Chairman Watson, Bo Watson from down in the Chattanooga area, and the Commissioner Butch Ely over Finance and Administration really wanted us to get it to more of a policy standard that would work for other locales too. And so we spent that following weekend, a number of us were between Chairman Watson and Mayor Jacobs and Representative Zachary and I spent most of the weekend, and I was actually out of town on a trip with my husband. I spent 2 days in the van. We were camping, but I said, I'm fine as long as Knox County and Knox City felt like that it was a fair arrangement and that it would work financially for them, because I trusted them with their expertise and their staff and folks that were advising them on the scenario. So at the end of the day, they came up with the idea of the direct appropriation in lieu of that quarter-mile expansion, which, I felt like the expansion wasn't much different than a tourist zone, but we agreed to that. And normally already in state law, if any stadium is built, you get the proceeds from the baseball. But because this was going to be a multi-sports, multi-event venue, we wanted to be able to get all the sales tax other than the first 1.5% that goes to education. We wanted to be able to capture that. So part of that agreement was putting in at least that $100 million in surrounding investments, which makes a big difference on the success of the whole development project. We oftentimes people do these projects and then, after a certain period, they refinance it and refinance it for additional 30 years. And so we said, absolutely not. We want to be fiscally responsible. It's going to be only financed for 30 years. And if we refinance it, we only refinance it for the outstanding balance. So I felt like that we helped get it to a good policy point of view, but at the same time, our local folks felt like it was protected. And as far as financially viable for Knoxville City and Knox County. So at this point now, ours was just enabling. If for some reason the local governments decide not to proceed, we don't get that $13.5 million, even though it's budgeted. I'll see if I can find something else to use it for. But no, it's as long as we proceed forward, I feel like that we've gotten it in a good position, mainly because of the research and the numbers crunching that our locals did, that they felt like this was a work for them.
Representative Wright, what's happening in your district with this baseball multi-purpose stadium? Is that something that out where you are, they're interested in? Are you supporting it? Just curious.
Yes, I've received phone calls about the baseball stadium and people not wanting it to be built because it's going to take away tax dollars. that conversation doesn't last long when people then realize what the facts are. This multi-purpose venue, entertainment venue that may attract a baseball stadium is also going to attract soccer and weddings and reunions and concerts. And it's just right under the interstate bridge from downtown, the old city. This is Becky, excuse me, Senator Massey didn't say this. This is a once in a lifetime opportunity to take advantage of. And then I like to compare a few, some people say not apples and oranges, but they may be apples and oranges. One of the sports facilities is going to have a $20 million a year break for 20 years. That was a different bill that moved through this year. Another location is going to have a seating license tax thing, which is $750,000 forever. And all that the state of Tennessee is doing on this venue is $13.5 million up front. And it's going to be a fantastic benefit to the city of Knoxville, Knox County, and the surrounding area. So this is something that has to move forward if City Council and Knox County Commission want to take advantage of it.
Good, thank you. Senator Briggs, I know you have led an effort to get funding for more medical residents in the state to try and help this physician shortage that we seem to be experiencing. Tell us about the impact of that legislation.
Yeah, what this will do is this really will benefit more the underserved and rural areas than it probably will be like urban Knox County with our medical centers. But what it does, it'll be the first time since 1996. Since 1996, the population of Tennessee has doubled, but the number of residency training spots that we have for primary care doctors, these are your family practice doctors, your pediatricians, people like that, has not increased at all because the federal government froze those back in 1996. What this does, it expands and starts a pipeline that will continue, and it'll also allow that pipeline to increase for a number of years going forward, because it's more than just bringing healthcare into a community. There's a very large economic benefit that comes to communities. We can see it right here in Knox County. If you look at the salaries and the employment and the level of the salaries of the people that work at our medical centers, you can see the economic benefit. Susan, before we go on, I just wanted to say, because there are some other bills that we passed this year that really affect business that I think businesses and the business community needs to be aware of. One has to do with the restaurants and some of the hospitality industry, because they have been asked during this pandemic to sacrifice probably more than any other industry. And we're going to allow them to have takeout liquor by the drink for the next 3 years. There is a sunset on that, but there was always a concern that we may be getting alcohol into the underage group. So what we're also doing is we're hiring more agents from the Alcoholic Beverage Commission, so they'll be able to investigate that better. We also gave an additional week-long food tax holiday, and this is also for the restaurants and the people that are serving food from July the 30th to August the 4th. And that will be in addition to the tax holiday that we have on schools. And again, we've asked for the hospitality industry to sacrifice, I mean, really more than anyone else. And then a third bill had to do with the government declaring essential and non-essential workers. This affects all businesses, particularly small businesses, where so many of them were closed down by these edicts. We said that the government will no longer be choosing losers and winners going forward. I sponsored all three of co-sponsored all three of those bills. So I do want the business community to know that we are thinking about them. We're trying to do what we can to help. We know that they have suffered a lot during this COVID crisis, and this may help particularly those that disproportionately suffered during the crisis.
Yeah, well, thank you for that. We had a chamber board meeting last week, in which several of our members are really struggling to get employees because of the unemployment compensation. At least that's their perception of that. And, you know, you see signs everywhere, help wanted, and I noticed some of the Wendy's, I think, and Chick-fil-A, some of them are paying $14, $15 an hour, to try to get some employees back. So it's a real concern. So thank you for doing that. Now, you all did pass a bill that would compress the time to receive unemployment benefits, but I think it's not effective till 2023. Is that correct?
December 2023.
Okay, so, and I believe it also increased the amount of unemployment by $25 or
Mhm.
$50. Talk about that. Becky, give us a kind of an update on that, because I know a lot of people that are on here today are really struggling to find help.
Well, I think you described it pretty well. It's really is a tough issue right now. And of course, that's all being driven by the federal government. It was hard to kind of come up with something. I know a lot of industries, people are choosing to stay home because they are making more.
Mhm.
And it's usually, our service related, our home care agencies like Sir Thomas Center and folks that are taking care of some of our most vulnerable. And it's just, our convenience stores. I've heard from a lot of folks like that. But this is going to be more, trying to work to help get people back to work. Right now, there are, it's an exorbitant amount of folks that are less people are unemployed than there's jobs available. It's by about, I think, 50,000. Senator Briggs is always my statistical person, but it really is a significant number of jobs that are available over the amount of people that are unemployed.
Senator Briggs, any thoughts on that?
Well, this is what with the bill that you were referring to, it indexes the unemployment, how long people get their benefits to the amount of unemployment there is. And what it's trying to do is, if we're truly in an economic downturn, it'll target more. I mean, we don't want people to be thrown out on the streets, particularly our lower wage workers. But on the other hand, we don't want to have these prolonged benefits when there's jobs that are available. And what this tries to do is to incentivize them to be looking for a job, because they know that their benefits are going to end, particularly once the economy turns around. I want to throw one other thing out there, because I may not have the opportunity. We're going to because this is absolutely a business related issue. We're going to have over $3 billion coming into the state from this American, the Relief Act that was Recovery Act that was passed earlier this year. The Comptroller's Office and Senator Massey has been working very hard with them to try to get them out to talk to the different communities. But the money will be coming in two bunches. There'll be one the first year and some the second year. And we really need to plan how we're going to work on this. It really needs just to be for one-time, non-recurring projects, but it may be an unprecedented opportunity to have our school facilities upgraded, to do some infrastructure, and to do other things that we can then take money that would normally be in the budget to use for other things. But it's going to have to be well planned. It's going to have to be well documented, because there's a lot of strings attached to it. But this may be absolutely, I mean, there's going to be so much money coming into the state. We may not even be able to spend it all, but we've got to really think about that now, because I believe the first bunch of that's going to be released on May 11th or May 12th.
May 11th.
Pardon?
Yeah. And let me add one more thing on the unemployment. I was just looking at this. The floor is 12 weeks if it's 5.5% or below of unemployment. But then for each half percentage of increase in unemployment, it goes up 1 week, up to a max of 20 weeks. So that's the other thing on that. And then we are going to be getting together the mayors and the folks of kind of a regional, the surrounding counties, and Knox County here. I think we're scheduling it for the middle of June is when we're going to be getting together, and the comptroller and his staff are going to come over and kind of give some some guidance. They still haven't gotten the full guidance yet. So
Right.
we're just encouraging people, don't spend that first dollar until we do get more guidance.
Yeah, I know the county is already talking about how much money is going to come in, a lot of for infrastructure, broadband, helping pay utilities bills, all that kind of thing. Do you anticipate they might go maybe a special session to talk about spending $3 billion? That kind of freaks me out, to tell you the truth, when you say those words. That we have an extra $3 billion to spend. Has anybody talked about a special session for that?
Let me say something about that, and that Representative Hawk spoke on the House floor that there may need to be a call session in September, but that was only talk. So we can only, from my point of view, look at it as being rumored, but I would expand on what Senator Briggs was saying. There's so much money flowing that we may have to go back in session to address all these billions of dollars. I did want to say something on unemployment. One of the things that's so important about the state of Tennessee, and I think the reason that so many people could be moving to Tennessee or Florida or Texas, is because of the dollar goes further in those places, and the unemployment figures being set at a national level. It's the same amount of dollars that you'd get in New York, California, but in Tennessee, they go a lot further.
Well, that's very true. And we are having people moving in here from, I was at an event last night, a new couple had moved from California here. So it's happening, and I have mixed reactions about that myself.
Well, as long as they don't try to make us like California or Illinois, if they come here because of the way our governments are run and our values and the way we are fiscally responsible, that's a good thing. But we just don't want them to come here and expect us to be just like all those other states that are in debt.
Yeah, that's my fear. No, I'm glad we're getting new tax revenues into Tennessee. I'm like you, just don't try to change our culture, right? Well, one of the things we've gone through this year of a pandemic, and there were some issues and discussions in the legislature about the vaccine and the forcing people to take a vaccine. Senator Briggs, talk about that. You're a physician. I think, did you guys pass a bill that you could not force people, at least government couldn't force people to take the vaccine?
Well, I almost, if it wasn't so serious, I would have found it amusing, because the governor had said that there'll be no mandated vaccines. I don't know of a single elected official that was advocating for mandated vaccines, but I believe it was a solution looking for a problem. Because there was no one in Tennessee that was going to mandate the vaccine. My only one thing I've learned as a physician, never say never and never say always. I really don't necessarily like to put laws that are going to handcuff future officials, because we don't know what's coming. I mean, it's the same thing on quarantine. We passed a law saying that they can't quarantine people that appear healthy, and there are other things. But if break of Ebola in Africa. And remember that Nashville is an international airport, and we had people flying in from Africa that were coming right from an endemic area with Ebola that may have a 90% mortality and maybe 3 or 4 times more infectious. I would, particularly these African residents that are coming in, I think maybe we need to quarantine them. By the way, if Americans go to Europe, you have to be quarantined for 2 weeks. And to say that in Tennessee, if we have people coming in from a dangerous area with a dangerous disease forever in the future, we're going to let them get off the plane and walk around. That's never been practiced anywhere, going back 300 and 400 years when we quarantine people coming, because of the smallpox epidemic. People were quarantined at that time, particularly if there were, outbreaks of smallpox or cholera or other diseases. And that was really my only objection. But I still thought it was a solution looking for a problem that didn't exist.
And Susan, one other thing on the vaccine, because is that basically the bill that was passed that just said a government or a government entity couldn't require a vaccine. But now a private business, you know, I know right now, I mean, and they could change, but, you know, once these cruise ships start going out, and actually they are going out at Bahamas, but they can require it. So a private business entity, you know, if they felt like that's the safest thing for their employees, they actually could. But because we can't control, really, we shouldn't be controlling what an independent business operator decides that they need to do for their business.
Well, does the government, does that include schools, that
Yeah.
schools
Yeah.
cannot require
Mhm.
Vaccines? How do you?
Now they can recommend them. They can, but you know, there is the religious and the moral exemption.
Well, we do have required vaccines for colleges and others,
Mhm.
and I think secondary schools as well, right? Already.
Right. And basically this was for the COVID-19 vaccine.
Gotcha. So it's specific to that.
Yes.
Let's turn our attention to one other issue that landed us in the spotlight on the national news. This is a bill that prohibited the teaching of critical race theory in the public schools. I'd like to hear from each of you on that. Is that something you voted for? And first of all, somebody explain what that means so that our audience that may not have read about that can really understand what it meant, because there was a very a robust discussion about that in the House and Senate. Becky,
Right.
you wanna take that?
Yeah, I'll go first. You know, I mean, I hadn't been listening to a lot of the national debate just because I had, you know, when you're in session, you focus on what's right in front of you. And I had some significant issues between fertility treatment, infertility treatment, and my cannabis bill and my medical cannabis bill and the baseball stadium. But you know, in looking at it, you start with what you can do. You can teach about you know, the history of slavery, the history of the civil rights movement, the history of the women's movement, Jewish Holocaust, you know, the you know, all the struggles they've had with discrimination in Africa, you know, the Japanese internment, any of those things, you can still do all that. And, you know, you just do the factual version of that. What you can't do, and when you start looking at all the individual points that we're saying that you really can't do, to me, it was really more an equality bill. Because you can't teach that men are better than women. I don't want anybody to teach that. You can't teach that one race is better than the other. You know, I mean, and so when you drill down to the individual points, I mean, I'm starting to look at that and I go, how can I vote against that? Because those are not things that I want somebody to teach. I want people to know that they can achieve, that they can be the best they can be. And just because, you know, they're a particular, you know, a particular race or ethnicity or a gender or sex, if they work hard and they try hard, I want them to know that they can be the best they can be, and that they don't already, you know, have to say, okay, I can't achieve because I'm not better than anybody else. They're better than me. So I think that is why I voted for it, because when you look at the individual points, I don't think there's things anybody would want taught to our kids. So,
Senator Briggs, your thoughts?
You know, when you're talking about teaching some sort of racial theory to first, second, third, fourth, fifth graders, I mean, I think that would be appropriate as a college level course, or maybe a graduate college level course in American sociology or American society, but I just didn't think that was appropriate. And actually, I think Senator Massey explained it very well. If you actually read the details of the bill, it said that it prohibited the teaching that one race was superior to another, that one gender was superior to another, that one's so-called class position in society was superior or should give an advantage. It really wasn't quite the eventual bill that came out really wasn't quite what it was. On the other hand, I was very sensitive to some of our colleagues in the Senate of color, because they, people, it depends on whose shoes you're walking in, how you see things. But it would be very difficult to support teaching this to children that may just not have the capability. I mean, even in high school, because the critical race theory, I actually read more about it. It's a very complex theory. And I don't know how much theory, sociological theory, we ought to be teaching in the K through 12 level. I mean, this is a college level, or maybe even a graduate school level discussion that needs to be happened among intellects, but it may just not be capable for young minds to assimilate.
Representative Wright, your thoughts? What was the discussion in the House?
Let me back up and say first that being a member of the House, and then the silo that I am, excuse me, the silo that I'm in is local government. And we're off talking about someone else's farm education. So I had to go look, and I hate to endorse Wikipedia, but there's several thousand words in Wikipedia about this theory. And as compared to even the history of the United States, a few hundred years, this theory is relatively then new, and it's based on what is your narrative of your understanding. We did have a bill that came across the House floor about the teaching of the theory in public school, and I voted in favor of the bill.
Okay.
Everyone will have to do their own research, in other words.
All right, thank you. Senator Massey, you mentioned your medical cannabis bill. Talk about that. I know this is something you've been championing for some time. Talk about what actually passed this year and explain that to us.
Well, I have to preface it. I said I've never touched, seen, or smoked, or even gone into a medical cannabis store or anything related to that. But this all started back in 14, or actually 15, when Representative Faison came to me and said, would you sponsor in the Senate this CBD bill with low THC for kids with intractable seizures, major seizures, 200, 300 seizures. And I said, are you crazy? No way. But then I started meeting the families and hearing their stories. And it was just so compelling that traditional medicine was the only way they could control the seizures, was basically to keep them so drugged up that they'd have no quality of life. And so I was able to pass that in 2015. And so I've kind of watched the medical cannabis debate since then. And, there's definitely strong feelings on both sides as far as it's not FDA approved, it's not descheduled, but, you saw it just kind of elevating in the conversation. Well, about 4 years ago, I watched my brother-in-law pass away with ALS. And the mental torture he went through with that. And I said, for no other reason, I would have to vote for a tight version, not something that was just a ruse for recreational marijuana, but something that had very strict parameters on it. And so Senator Dickerson in the Senate had been the champion of it, and I've been watching it. Well, he did not return this year, was defeated this past year. And so I said, okay, I'm willing to carry it as long as it has all these parameters. And I actually worked with TBI and police chiefs and folks to put parameters on it that was able to work. Well, amazingly enough, I got it through, overwhelmingly through the Senate Health Committee. And I got it through the Judiciary Committee, which nobody thought I could do. But basically mine just made it where if you bought it out of state, you could bring, and you had these 11 diseases, that were very diagnosable, you would not be criminalized. And in a year when we were doing criminal justice reform, I said, what better criminal justice reform than to not criminalize people that are very sick, very ill. And so we were holding it to watch the House side. It passed through the House Health Committee, and in criminal justice, it basically lost by 1 vote. And actually, Speaker Sexton, had it been a tie, was ready to come in and vote for it. So it was very close in the House. But we had Senator Hale had a bill for a cannabis commission, which I was signed on as a co-prime sponsor on that one. And basically what that was doing is going ahead and putting in a commission to start looking at when it is descheduled in Washington, that we know how we want to, if we want to grow it, how we wanted to do it, issue the permits, how we were going to sell it, prescribe it, monitor it, the whole 9 yards. And there is a lot of thought that we're close to getting it rescheduled in Washington. Some people think it's as soon as a year. I'm not as confident that Washington will move that quickly, but it is. But when they do, we need to know what we're going to be doing with it, even regardless of when it comes down. So this would go ahead and put things in place for that. So what they did is they combined a portion of my bill, and so there's 9 diseases that are listed there. You have to be diagnosed by a Tennessee doctor, and you have to have documentation. But if you purchase it out of state, you can have it for a low THC and oil only. That you can have that here in Tennessee while we're waiting, and that's immediate as soon as the bill is signed. And but it's it's not everything. There's definitely winners and losers, but it is some relief for some people that are our sickest Tennesseans. And then this cannabis commission will start working on looking at the other state laws, how they're working. I know Alabama just passed a comprehensive medical cannabis law. So I mean, I think it's like 44 or 45 states either have either recreational, or most of them are medical cannabis in their states. And we're just one of the few that doesn't have some form. And so this will give us at least a little bit.
Thank you for doing that. I know a lot of people that actually need it for the diseases they're having. So appreciate that. You mentioned the governor's justice reform bill. That's something that certainly was one of his major priorities. And I think the bill that finally passed was a little bit watered down from what he wanted originally, but expands alternatives to incarceration for some nonviolent offenders. Senator Briggs, your thoughts on that? Is that something you supported?
Yeah, I did support it. There were a lot of good things. That's always been very high on the governor's agenda, was criminal justice reform. In my state and local government committee, we had a briefing on what Texas has done. Texas has cut over $1 billion out of their budget. Now, Texas obviously is a larger state than what Tennessee is, but our entire budget for corrections is just a little over $1 billion, and Texas was able to close, I think it was 1/3 to 1/2 of all their prisons over some of the things that they've done with criminal justice reform, and they've not seen any increase in crime. One of the other aspects of that was increasing the training that inmates would have while they're there. And some of those inmates can actually leave prison with Tennessee licenses to be certified electricians. They have training programs in welding. They have training programs in carpentry. And these jobs are in high demand. At the women's prison, they actually run a call center. And they have, when these women are being released, businesses who are having a hard time recruiting people to do those jobs are asking the Tennessee Department of Corrections, will you let us know when people are getting out of jail, because we need to hire people with this. And I think that that's one of the primary things. See, before we just put people in prison, nothing happened. They got $10 in a bus ticket and were put out on the street. They had no way they had no place to go, no place to earn a living. We're opening more halfway houses. We did this right here in Knoxville earlier this spring, where we opened one where prisoners could go. We're giving them the training. If you actually go to the prisons, they look like our Tennessee colleges of applied technology, only with bars and barbed wire. But they do have the opportunity to gain those skills, and I think we're seeing that we may have overdone some of our mandatory sentencing in the 1990s, and we're revisiting that to see if we can't do it smarter and better than what we were doing then.
Well, thank you all. I want to leave some time for questions. I'm going to turn that back over to Amy and see if we have any questions on our chat screen, or if any of you have questions that you would like to ask.
We did have a couple comments from Tom Ballard, and I will join him in this. A big priority of the Chambers, Life Sciences Tennessee, Launch Tennessee, and some other organizations was matching funds for small business, innovative research grants, and technology transfer grants. And these are federal grants that are awarded to small businesses that are commercializing technology from Oak Ridge National Lab and UT. It was cut from the original, and then state funds. What we do is state funds, if a company gets the federal award, then the state will match that, really only up to, I think, 25, 50%. But it's really important because those state funds come with less ties. So it really accelerates the growth of those small businesses. We believe we're uniquely situated to take advantage of those. So we went from no money in the governor's budget to $3 million in the amended budget, to another $4 million in the legislative budget, for a total of $7 million. Those dollars have always been oversubscribed. I think Tom believes we can spend those and really deploy those in the community very, very quickly. So very important to regional economic prosperity. So I want to thank you all for that. And Tom does as well. So another comment, we have Chris Whaley, president of Rome State Community College, and he wants to also acknowledge, and you may also want to comment on this, although I know we don't have anybody from education, but the state did put additional dollars into dual enrollment courses, and that of college courses that high school students can take while they're in high school. Very efficient for not only the student, the state, but the employer, and also middle college, which is kind of the same concept. So two allocations I think that are very important to creating this highly skilled workforce that we all desire in Tennessee. So thank you for those. Did have a question about kind of recovery funds for small businesses related to COVID. A lot of companies spent money for cleaning, sanitation, kind of business practice changes, but did not qualify for relief funds. I think a lot of these are on the federal level, but on the state level, kind of anything. I think you touched about the restaurant relief. I believe we had some 30 million that was set aside by the state. Kind of any other issues around COVID relief funds available for businesses.
I'll just chip in here. And yes, Amy, you are correct, is that those funds are all federal, and there were a lot of strings attached to those, which limited what the state would be able to do. I think that is something that would need to be addressed to our federal representatives. The state, because there was a lot of money coming in from the CARES Act, and we know there's going to be more money coming in now through this Recovery Act that was passed a couple of months ago, is that the state just did not, well, first of all, we just don't have the funds at that level to do what a lot of people are requiring. But I think those questions would have to be addressed, at the federal level about trying to recover some of that funds. And we understand that businesses have really, particularly small businesses, have really suffered during this. But as far as how those funds are spent, it would have to be addressed at the federal level, because there were a lot of strings attached to that. But that's a very good question, and we appreciated hearing it.
Thank
Well,
you.
and one other thing, this isn't exactly for the cleaning supplies and things, because, unfortunately, I worked with some businesses that, were affected, that weren't in some of the winners and losers type category that were picked type thing. But with our F&E taxes, that it exempts the COVID relief payments received between March 1st of 2020 and December 21st of 2021 from the state's franchise and excise taxes. So it provides that excise tax deduction from Tennessee's business and entities that have received or will receive such relief payments. So that'll help some.
Okay. We did have one question too. Changes in the election laws have made a lot of news in Florida and Texas. I think there were some proposals that were similar, but my understanding is any changes we made were pretty minor. Dr. Briggs, you had, I think, one related to convenient voting centers, but it was not the reach that was in some of the other states. Can you discuss
I think
that?
the reason, I really appreciate that question, and all of those do come through the committee that I chair, because that did make national news about problems with voting. Tennessee was never mentioned a single time as having a problem with our voting, and that's something we were very proud of. And I think we're pretty close to doing it right. We did pass one bill that will put a watermark on the absentee ballots that go out for people that are requesting them, and that would prevent any counterfeit ballots from coming in. We did that. We did not make a lot of other changes, and if we make it very easy for people to register to vote, we have a very long early voting period. We have 14 reasons that people can get an absentee ballot, and you don't even have to have a reason if you're over 60. So I think we're doing that part right. I think it was a good idea to put a watermark on the ballot that eliminates any questions, or it makes it very difficult for someone to submit a counterfeit ballot. The voting centers that you're talking about was a bill that I carried. It won't be effective for Knox County yet, but we now have 7 counties that we've run a pilot project on, where just like in early voting, where you can go to any voting center to vote, is on election day. Now you have to go to your precinct. So if you work downtown and you weren't able to early vote, you would have to, for instance, I would have to go all the way out to Farragut for downtown, and it could be a lot of difficulty to vote. The voting centers are on election day. You can vote anywhere you want to vote, just like we do for early voting. We've done that now in 4 counties. We're adding 3 more counties to that. We expect to add that every year. It would be permissive, which means that the local governments would have to say, we want to do this. It has met so far with just overwhelming public support for this. They really like that convenience. And we're calling these the voting convenience or convenience voting centers. We will see this eventually in the larger metropolitan areas, but we wanted to roll it out slowly to work out to any kinks and to be certain that this is going to work.
That's fantastic. Thank you all. Okay, I'm going to thank you all for being here. Wrap it up. We don't have any other questions. We appreciate each of you, the work you continue to do in the state of Tennessee and specifically for the Knoxville region. We also appreciate our sponsors who help make the Chamber's work of driving regional economic prosperity and events like this that allow our business community to connect with our legislators. Thank you, Iris Network, Shod Companies, AT&T, and JP Morgan Chase. Senator Briggs, Senator Massey, Representative Wright, I hope you enjoy a little more time in your life with the session out. And everybody, you all have a great weekend. Thank you for being here.
Thank you all.
Thank you.